Hello, my name's Rod Matthews, and I believe that we may be spending some time together on Sunday, the 19th of July. And the reason why we may be spending time together, as I understand it, is that you have spent a considerable amount of time developing your expertise in the area of diabetes through the membership to the group at the Royal Prince Alfred Hospital. And as such, you're in an excellent position to be able to share that expertise with your peers and provide them with the opportunity to be able to reduce the stress and frustration that can be associated with dealing with patients with type 2 diabetes. You also have an excellent opportunity to increase the quality of patient outcomes and clinical results amongst your peers. And you also have an excellent opportunity to do some things to be able to increase the likelihood that your opinion is sought after, listened to, and acted upon. And there's a couple of ways we can do this. There's a couple of ways you can share your knowledge. There's the formal way and there's the informal way. The formal way is, of course, to hold a meeting, invite some peers, get them together, and to present the information that you've gathered. The informal way is, of course, when you bump into people in a corridor, in a cafe, at a conference, these sorts of things, and you get the chance to have a bit of a conversation. So what I thought I'd do is to just give you a bit of a taster as to the sort of things that we can talk about when we get together and look at a tool that will help with sharing knowledge. And one of the things that I often find when it comes to, because I have worked quite a lot with GPs, specialists and nurses as well in a similar sort of environment, and one of the challenges that I find that they face is being able to deliver the information in a format that is digestible for their audience. It's very easy to fall into the trap of delivering too much information or delivering information in a way that just leads to people's eyes glazing over and them switching off, and we end up talking to ourselves. So, how do we do this? How do we deliver information in a way that engages our audience? Well, there's a couple of things I would suggest. One is preparation and another one is structure. First of all, preparation. What often happens when we prepare presentations or prepare to share knowledge in a formal environment is that it's very easy to put together a PowerPoint presentation type thing and just to type in the bullet points and to think that that is our preparation done and dusted. But what actually happens when we put together preparation and put together our presentation in that way is that our mind makes intuitive leaps about the content. So we think to ourselves, oh, there was that particular case with that patient who was having difficulty with the insulin pump, for example. And so then we just type in the bullet point, insulin pump case, and we leave it at that. What we haven't done is we haven't actually practiced that case verbally out loud. And so the first time we actually put that case into words is in front of the audience. And because we haven't practiced it, we end up going through it about 14 different times, saying the same thing over and over again, trying to find that wonderfully succinct way that we should have prepared in our own room, but we haven't prepared it, so it comes out as gibberish. And we lose the audience. So the first thing that I would strongly recommend is that you practice what you are going to say out loud. Thank goodness for the invention of hands-free mobile phones in the car, because I do this in the car and this is where I can pretend that I'm speaking on the phone, but in actual fact I am preparing what it is that I would like to say. So point one, prepare out loud. Point two, structure. If you're going to present something like a case study, you'll need to have a structure, and this will help reduce the amount of stuff that we give the audience that is unnecessary. And there's a fantastic structure that works well for this, and that is STAR. Situation, task, action, result. Great structure, for presenting case scenarios. Allow me to give you an example. And before I go into this example, please be aware that I do not profess to be an expert when it comes to treating type 2 diabetes patients. I'm not even a GP. So please excuse the naivety of my example. I'm just trying to illustrate the structure a little bit. Having said that, here's how you may use STAR to present a case study around diabetes. The situation was that patient X presented with the following symptoms. They had this symptom, that symptom, the other symptom. The task ahead was for me to be able to correctly diagnose what the patient was suffering from, and then find out a little bit about what treatment was going to work best. So what we did is we sat down and we conducted this test, we did that, we did the other, and we asked the patient a few questions to establish their lifestyle, what was important to them, what they do on a daily, weekly basis. And as a result, because we know that there's many different types of treatments for insulin, there's the pumps, there's the orals, there's the injections, we were able to make a decision around that for something that suited the patient's lifestyle. And as a result, the patient was far more compliant with their medication to the result where today they no longer present with symptoms. It's how STAR may sound for presenting a case study. And this way, if we have practiced it out loud and verbally, and we have a structure behind us, then we are far more likely to present the right information in the right amount, and we are able to find this magic mix between style and substance and put it in a format that is most digestible for our audience. So thanks very much for watching this video. Very much looking forward to seeing you in person on the 19th of July. Until then, have fun. See you later.